So, Dr. Lindsey and Wendy here. Wendy's going to participate in this video because it's a younger patient that bonded with you, and I think you somehow he got Wendy's number and wanted to have a hair transplant when he was like 18, and I said, no, he's got a bad family history, and it's a 3-year saga before we finally agreed to do the first of 2 hair transplants. And this is a young guy that's now a psychologist, right?
Mm-hmm. Yeah. So I got involved because you said you told the guy that he was young to wait to see where the hair loss was gonna bring him to, and to wait to be 27. That way it would be worth for him to be shaved and be done, that he would not feel.
Oh yeah, I didn't think he was that thin. He was his own worst critic.
Yes.
And then he did get thin.
And then he got thin, but he was disappointed. He's like, he doesn't want it, and it's not ready yet. If we were to do your hair transplant the day that he came in, it was exactly 1 year. Then I said, we're just like, he'll be opening a slit where there's still a thin hair that's probably going to go away.
Just we don't know how long.
We don't know. Years. So just wait until it goes away, and then we'll take care of it. So
ultimately, he came in, and his mother was here with him, and we came up with a plan to do 2 cases on him, and so here's an interview with him. So, Steve, how old are you, sir?
25.
And I think we got another video on you, and so essentially you're the same age as my son.
Yeah.
And I talked with you about, you got to plan on doing a couple of these things and getting an age-appropriate hairline. So up to your right is your before picture, and you were really quite thin. Yeah. I can't remember. Did you use medical therapy before we started all this, or not?
I did not. Yeah.
Okay. And then, and you coming from a family part, a lot of people get pretty bald, and so I really tried to beat you into not doing this for a couple of years, right?
That is correct. Yeah, I was stubborn too.
And I brought your mom came with you. I didn't pull any bullshit. Didn't try to talk you into any kind of nonsense,
nope,
right?
You were straight up. Yep.
So, and then we did the case that is up to your right, and then that is 23 months ago, and then last year you came in and we did your crown, and that's been about 9 months since we did that.
Yep.
Has this changed your life? Hadn't done anything, to be honest?
It changed immensely. Like, I'm really much more confident, honestly. So, like, patience is key. So, I was straight to it. So, like, I was like, okay, let's go.
And how much did the whole thing hurt?
Not really, because you numbed me at first. So that's why, honestly, no pain whatsoever. It's just a process afterwards, but patience, like I said.
Reach up and pull on your hair like I was showing the other dude. Yeah. And pull on, So, I don't know whether you have a boyfriend, girlfriend, or whatnot. Does anybody pull on your hair? Everybody?
Yeah, my girlfriend.
Very good. All right, turn around and get the back of that head. And again, this is 9 months after we did your crown. I'm going to pull on your head. Mm-hmm. Looks good. Look up at the ceiling one time. That's awesome. And your before picture is over to the side. Turn back around if you would. Any advice you want to give people? Because doing hair transplants on 23 and 25-year-olds is really controversial, so I try to beat people into thinking about it. But clearly it worked for you.
Yeah.
Any advice you want to give?
Honestly, think thoroughly. Like, it's a process. I honestly, I had to think thoroughly. Like, Dr. W was like, okay, it's going to take time, honestly. But if you know what you're doing, obviously we're young, I'm young, and so I was like, okay, I want this now so I can be confident through my 20s. So, yeah, patience is key. Do your research before doing this, because it is a long process. Like, it's not like you're doing it instantly and just 1 month you're gonna have your hair. No, it's like you're gonna see the results a year after, or full results.
And don't let some sales chick talk you into saying that you got to do this tomorrow. There's never a rush.
Exactly, no rush. Do your research, because you don't know what's out there, and there's marketing, things like that. So do your research, stick to the facts, and if you want to do it, talk to Dr. W. Okay, so. All
right, man. Thank you so much for your business.
Yep.
And so he's got his whole life ahead of him. And I know he told me that his social life is dramatically different. Not because he looks so much, but because he's got the confidence, right?
Yes. So he is moving out of his house, and that's what he was telling me.
His parents' house, you mean?
His parents' house. Yeah. So he's getting his own place in DC. It's
Yeah.
He's happy. His life is like.
So for all you younger guys, you make sure that you're going to conceivably need a couple of these. You ought to have a hairline that should age well. You need to save some hair for the future. Even if you get 2 cases and there's still a little bit of work to be done and you're young, meaning under 40, maybe wait a little while on whatever needs to be done, just in case you need to tie things together down the road. And never rush into this. Think it through. If we can help you, please give us a call.